a lot of scandals have happened in healthcare, right, that have caused people to raise their eyebrows. Most recently, a doctor was put in prison because he diagnosed cancer, had people treated for cancer because he was getting kickbacks from pharmaceutical companies, right? And so what we do and the people that we serve, that community has been hoodwinked plenty in other areas just because of the social economic situations that they might be in. And so it is super important for us to provide the absolute best healthcare that we can possibly provide and strive to do that every single day, which in turn builds trust and the dedication to United Health Centers.
I've been short tenure here with the organization, but I can tell you my initial assessment at this point is that providers are extremely passionate about supporting and helping their patients. You can feel it in the atmosphere. You can see it in their faces. You can hear it in the conversations. And I just believe that that is a huge part of my role, to be sure that I lead the charge in helping to define and support the culture that makes this organization one in which patients feel it when they come in and experience that as well in the betterment of their health.
And our job really is to understand, hey, not only are you bringing in high blood pressure or high blood sugar, but you may be bringing in really poor access to food or the inability to drive yourself to your appointments. It's our job as a provider to really try and understand those barriers. And then, look, I can give the best medicine possible, but if my patient can't get it or can't afford it or can't get a way to be there, it doesn't matter.
I took care of, years ago now, a very dear patient who, when he arrived to us, had been going to the emergency room like almost weekly for a long time and hadn't had a regular primary care physician in years. And that was for a variety of reasons. He spoke only Spanish, and so there was a language barrier. He had pretty low health literacy, so hadn't ever had any kind of formal schooling. He had started working when he was very, very young and had navigated the healthcare system both in his home country and then here, but with some difficulty.
So building trust is building rapport. We have a lot of clients that come in who don't want to share their personal tragedies or their personal stories based on culture or religion. So we have to let that person be a part of their journey, let that person be a part of their healing. If they're a part of it, then they're more amped to be able to provide you with the information that you need. So building trust means being honest, being open, sharing with them, not telling them what they need to do, but guiding them through the pathway of success.
You could tell that when he first came to see us that he was not quite sure what having a regular doctor actually meant, because his experience of the healthcare system was largely just in the emergency room. And he had a lot of medical problems as a result of that. And it took many visits, truly, before I think he felt very comfortable with fully sharing his life. He had had some trauma in his past too. And truth be told, I don't speak Spanish, so I have to communicate with my patients through an interpreter.
When a patient comes in and we don't speak the same language, I think oftentimes the patient feels like they're somehow less than or not equal to, and it's like, nah, I feel less than. Like, I should just be able to speak your language, right? And so that's kind of how we view it here. We try to make sure that everyone feels welcome and cared for in their language of origin. I don't need you to speak English necessarily to get adequate health care.
Over months, he really started to be able to share everything that he had experienced. And we saw his emergency room visits just really plummeted from going almost weekly to he would go months and months and months in between ER visits. And from a practical standpoint, that's good because he wasn't incurring these huge ER bills, but truly his health improved. And he actually was able to consistently take medication for the first time in a long time.
I think it's a big impact to actually have an in-house pharmacy here at the clinic. I've worked retail pharmacies where we don't have access to their medical record or access close proximity with their providers. And usually there's a lag time of actually getting the right prescription or prior authorizations actually worked on.
With the pharmacy, we have to bridge the gap in patient care.
A lot of times when patients leave the doctor's office, that doesn't mean they always have a full understanding of their medications. But having that benefit of the pharmacy, a one-stop shop at United Health Centers, the patients can stop by and then we could continue to counsel them on their medications because we could just walk over and speak to the doctor. So that creates a huge win for the patient.
So those kinds of stories actually happen pretty frequently for us because of the patients we serve, having come from many different backgrounds where healthcare may not have been as accessible. And unfortunately, even in Winston, a city as big as ours, where healthcare should be very accessible for everyone, there are still people that fall through the gaps. And so we connect with folks like this all the time, who are really getting back into primary care for the first time, sometimes as an adult, or the first time in a long time.